On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way.
Welcome to Health Her Way. I'm Meredith Cunningham.
And I'm Brooklyn Elbert, and today we're joined by Angela Westfall.
Hey.
Angela is a certified nurse midwife at Covenant Health, and she has decades of experience providing care to women. So we're super excited to have her today to talk about the thing that all women have, the period.
Yeah.
So one of the reasons we wanted you to come here today is I feel like it's, first of all women get their period.
Yes.
It is part of life that we will all have to deal with at some point in time. Sometimes that comes a little earlier, a little bit later, starts and stops at different times, but we will all go through it. But I feel like, especially when you're young and it's the first time, you may get a really high level description of like, yeah, this is going to keep coming once a month or whatever. But I don't feel like maybe we dig far enough or deep enough into what's actually happening to our bodies through this time. So you're going to dig in and you're going to help us today.
Sounds good.
Let's start with the most basic of basic questions. But what is a period? What is its purpose? And what is the process?
So really, you can't really talk about your period without talking about the whole cycle.
Okay.
Right? But the period itself is what starts the cycle. The period is just the sloughing off of the extra tissue that's been built up to support a pregnancy. That happens every month. Your body prepares to support a pregnancy every month. And so when your body tells your uterus that we are not using this, extra tissue, then through a series of hormonal triggers, that lining sloughs off, basically. And that is what your period is. And so the first day that you start bleeding is the first day of your cycle.
So it's all part of the reproductive process.
Yes, absolutely.
Okay, so obviously the reason that it's there or its purpose is to help us one day make babies. Yes. But we obviously don't make a baby every month of every year.
Absolutely.
And so we just kind of have to deal with that part of it in the meantime.
Yeah.
With that being said, when do most women kind of like, honestly, I guess when do most girls start getting their periods?
Personally, I've seen girls get their period as early as 8 or 9.
Oh, wow.
That's not usual.
Okay.
But that has happened.
Okay.
For sure. But the average age in America is from the age of 10 to 16.
Okay.
With the average age being about 12 and a half.
And then I hear sometimes like those, I think you were really athletic. Mm-hmm. Maybe they get them a little bit later if you're like an athlete in high school or in middle school.
Well, and what it usually has to do with is the fact that a lot of athletes just have a very low level of body fat. Mm-hmm. And so if your body fat level drops too low, then you won't have a period.
Okay.
Essentially.
Let's talk about those youngins real quick.
Sure.
What is the best way, especially, I don't know if you're seeing patients this young, but, or like you have moms who are like, oh my gosh, my daughter just got her first period. I don't even know honestly what to say to her or how to help her. What is the best advice? Because I think we'll all of us one day will have daughters, nieces, friends that will maybe want to help support through this time.
Oh, of course.
So what's the best way to talk to them when they're this young about the first time and like just learning what their body's doing?
Yeah. So there's a couple ways, and it really depends on how old that kiddo is. The reason I was sort of excited to do this is because my whole thing is empowerment. So I really think we need to start normalizing periods from a young age so that when it happens to someone, they don't think they're dying. Mm-hmm. They don't think, oh my gosh, I have no clue what's going on. They're frightened. But even as soon as, if you're 4 or 5 years old and your daughter says, Mom, where do babies come from? You can just say, babies, there's a special place in mommy's body called the uterus. And that's where a baby is grown. But on months where a baby is not grown, in that little box, there'll be a special place for the baby. And if that box isn't used, the mom will bleed a little bit, but it's not a problem. Mom's okay. You know, so there's ways you could talk, like that's for a very small child, obviously. If you have an older kiddo, you can use more up-to-date terminology, you know. But I think it's really just explaining the basics of, you know, a woman's body. And the importance is not just with your daughters and your nieces, but also with your sons, because many of your sons will end up marrying a female. And so you want them to be able to know, okay, what's going on here? You know, what can I expect? Why are things crazy? What's going on? You know? And so I think normalizing it with just all children, that it's a natural part of life and it's not anything. I think in the past, it's been really, people have this connotation like it's something that's dirty or taboo, or we don't talk about that. And I just think that's done everybody a big disservice. You know, there's a fabulous book series that American Girl puts out called The Care and Keeping of You. And there's a like a Care and Keeping of You 1 and Care and Keeping of You 2. And so the 1 just starts with basic, like, how do we keep our bodies clean? How do we, you know, like basic hygiene. And then the second one, I think, goes more into, okay, how do we break it down for an 8 or 9-year-old, like what's about to start happening in the next few years. And I think they do a fabulous job. So if moms or family members feel sort of like, oh my gosh, I could never say the word uterus. I could never, like just thinking about the word blood makes me want to pass out. Like you can literally just read through this book with your child or your niece or your loved one, whoever that is. Another time that you can bring the topic up is when you're actually buying those supplies at the store. Your kids are with you, you know.
You said something in there. You said, you know, you said mommy has to bleed, but mommy's okay. Let's be honest though. Our period is not.
We are not.
We're not actually okay. I mean, we're okay. We're not gonna die or anything. But like,
no, they're
it's
not.
our least favorite time of the month, and so some people may be impacted obviously a little bit more than others.
Yes,
the same
of course.
symptoms won't show up for everybody. But let's talk about the most common symptoms that we will see monthly.
Yeah.
And then which ones maybe are not okay, and you probably need to tell your doctor that
Absolutely.
this is happening.
Yeah. So it's hard to know like what is really a common symptom because maybe our diet is poor or we don't exercise or we're low on calcium and magnesium. But in the spirit of what you're saying, it's totally normal to feel bloated. It's totally normal to feel on edge, feel irritable. It's totally normal. Sometimes people start having cramps before their period even starts, and that's how they know their period started, you know, which
Back
is
pain.
The
is
warning
horrible.
signs.
Yeah, the warning signs. Hello. You know, so those type of things a lot of people experience. I don't know if normal is the right word, but it's not abnormal. It's just some people experience them and some people don't. But I'm looking forward to the research they're doing now on how could we possibly like eliminate PMS. That would just be amazing. Oh, you know,
Sounds like a dream.
but really exercise is very helpful to help with that. Cutting out inflammatory thing, you know, caffeine, alcohol, I know that can be hard to do for some people, especially if that's, you know, the way
You're coping.
wind down from a long day. But those are more normal symptoms. Some of the other ones are, you know, you might feel a little bit more anxious. You might cry at the drop of a hat, you know. You might just feel more sluggish. You don't feel as motivated. This is all within that, what we call the luteal phase, you know, which is the phase that happens right after ovulation until the last day right before you start your period is that luteal phase. And so your progesterone is dropping. And as your progesterone is dropping, you're starting to feel, there's many theories on why we have PMS, but one of the theories is that because progesterone drops, we start having a little bit more anxiety and a little bit more bloating and all of these things, you know, so that's one theory of many.
In recent years, we've heard a lot more about like PCOS and endometriosis because these women have been suffering for years with these incredibly painful, immobilizing periods or the heaviest flow where, you know, you just cannot. Are those things that you definitely it would be maybe more on the abnormal side that we would need to mention to our providers?
So really what you're looking for with abnormality, the first thing I wanted to touch on is the mental health aspect. If you are feeling like rage, like all out like rage, like I don't know that I really want to keep living, or, I wish I wasn't here. These kind of thoughts are common with a disorder that's called premenstrual dysphoric disorder, or PMDD. So from a mental health standpoint, that really needs intervention quickly. The hallmark of that disorder, though, is that you have those feelings and those difficulties all the way up until your period starts. And then once your period starts into the first maybe 24, 48 hours, maybe 72 hours, the symptoms completely go away and you're fine. So that's the difference between that and something like major depression.
Long-term, yeah.
Long-term chronic. But no, if you're not having periods, absolutely, that could be a symptom of PCOS, and you really do need to see a doctor, because if your endometrial lining is not shedding every month, then it's building up, and that can contribute to overgrowth of cells, which can also contribute eventually to endometrial cancer. So if you're not having a period, it's a wonderful break, I know. But if we're not having periods and we're not on contraception that keeps us from having periods, it's very important that we are having those periods. Endometriosis, if you are having pain that is not managed by over-the-counter analgesics, definitely that is not normal. Absolutely. Unfortunately, endometriosis can only be diagnosed during a surgical procedure, but there's a lot of endometriosis that goes undetected. And women for years have had horribly painful periods, not even knowing that their pain is abnormal. And so I think that's a good gauge to say, if you take a max dose of ibuprofen or a Aleve and nothing is touching your pain, that's not normal.
Okay.
That's too much pain. Absolutely. If you are 40 or older,
okay,
and your periods are getting more painful, more heavy, just crazier, that is also definitely a reason to go see your doctor.
Okay.
Even though it's a hormonal change that's happening in your body because you may be entering perimenopause, it can also be a sign of endometrial cancer. And so it's very important to have a workup done to make sure that you don't have endometrial cancer, because your periods should not be getting worse. They might be getting weird, but they shouldn't be getting worse, more painful, super heavy. That shouldn't be happening.
That is one of my favorite things I think someone has ever said. Weird, not worse.
Yeah.
They can be weird, but not worse. So.
Yeah.
So you mentioned that you can't talk about the period without talking about the whole cycle, and you kind of tapped into the luteal phase a little bit already, but can you talk a little bit more about each phase of the cycle and what women need to know about each phase?
Sure, absolutely. So, of course, the first phase of the cycle is in the follicular phase. We call it the follicular phase because we start out with the menstrual cycle, but in the process, as that's ending or throughout the time of your period, your body is getting a new set of eggs ready to go, right? So about 15 to 20 eggs it'll prep every month. And each one of those eggs will have a little follicle around it that produces estrogen. Okay, so they all sort of sit in there and develop. And then whichever one is the dominant follicle, you have, through a symphony of hormone spikes, you've got follicular stimulating hormone in there, you've got luteinizing hormone, you've got estrogen. So these different hormones spike right around the same time, and that causes that egg to be released. It can be from either side, but that egg is good for about 24 hours. But ovulation is just the release of that egg, basically. Mm-hmm. And that happens usually between day 14, day 16. It's important for women to know, the other reason I was really excited to come on and talk about this is because I really want to just impress upon people the importance of tracking your cycle. There's a lot of ways to do that, but to actually know when you ovulate, the key trick that most people don't know is ovulation is what determines how long your cycle is going to be. because after ovulation, you only have a 12 to 16 day window before your period starts. And this is why you have some people with like a 44-day cycle that aren't pregnant, because the follicular phase has gone on and on and on for so long, but they've never actually ovulated. And then ovulation happens, and then you have a standard 12 to 16 days after that before your period starts. So the follicular phase can be a little bit
Fluid.
It's usually not. We don't want it to be, but it can be.
Because we want a 28-day cycle, right?
That's ideal, but anything between the range of 21 and 35 days is within the realm of normal.
Okay.
But the 28-day cycle is like the textbook, classic. But I really encourage people to track their periods and know when they're ovulating, because especially as I've worked with patients over the last couple of years, a lot of people are just following the app that says you're ovulating on day 14. Well, unless they actually check their urine or their temperature, they may not be ovulating on day 14. They may be ovulating on day 16. And if they're not timing intercourse for day 16, they're never going to get pregnant. And it's not because anything's wrong. It's just because they're not ever having intercourse when ovulation is occurring. So it's vital not just to get pregnant, but also to not get pregnant. It's very helpful to know when that ovulation occurs. Also, it'll help you pick up on potential problems in your menstrual cycle, problems like PCOS, that are common with disruptive, irregular cycles. So if you've had regular cycles and all of a sudden you start, bleeding after 2 weeks, and then you have a 2-week period, and then we have a 2-week break, and then we bleed for another 2 weeks. Well, that is certainly not normal. But if you're not tracking your cycle, you may not really keep track of the details or how long that lasted. It may just be like, oh, my period's been messed up for months, But everything you can track is data that you can take to your healthcare provider.
So what do you recommend is the best way to track? Is it the strips, or
is there an app?
There are so many apps. I mean, one of the newest, coolest ways is the Oura Ring, but I don't think everybody should go out and buy an Oura Ring by any means. But I mean, there are I like temperature tracking, and you can do that as simply as with a basal thermometer. It needs to be a basal thermometer, not just a regular digital thermometer. You take your temperature before your feet ever hit the ground in the morning, and you track that temperature. And what that will tell you is your temperature will spike after you ovulate. So if you do that every month, you can look back and retrospectively know, okay, I ovulated on this day because my temp went up on this day. Does that make sense? So if you're doing it, it takes a little bit of time, of course. But there's a fabulous method called the fertility awareness method for people that really would like to not use hormones, or maybe it's against their religion to use hormones. But it's a great way of just knowing what your cycle's doing. And it's an old book, but it's a very good book. And I've really recommended it to a lot of people because it's very clear and it's very concise, called Taking Charge of Your Fertility. But there's so many ways. There are urine tests that you can buy. They're just expensive. Now, the ones that you can get on Amazon with the pink lines, they make me a little crazy, because it's like, what shade of pink? And you're like, okay, but there's like a million shades of pink it could be. So I really
Oh my gosh, I have PTSD from those strips.
Yeah. So I usually don't recommend those to my patients, only because I feel like you just makes you crazy, So one of the ones that we recommend, I'm sure there's more on the market, but the Clear Blue Easy Advanced are pretty simple and easy to use for people that are trying to get pregnant or just want to know when they're ovulating, for informational purposes. But you can do that with temperature. You can do that with urine test. You can actually check the status of your cervical fluid. And you can check the position of your cervix to know when you're ovulating.
I do not feel qualified to do that.
I'm like, do you have to go to the doctor?
That might be one of those things. Can you imagine me at my next OB appointment? Bennett, how do I do these checks? Oh my gosh. And she would teach me. I should probably honestly love that, actually.
It's in that, like I said, it's in that book, Taking Charge of Your Fertility. She teaches you exactly how to check your cervix and how to know if your cervical fluid is ripe for fertility and all that stuff. And it's really fascinating, but you can know a lot from your body just by the signals it gives you. So that's basically, I forgot where we left off. It was ovulation or the follicular phase.
Let's quickly go through them real quick and just name off. And like you said, it starts with menstrual and then follicular. So just start them and name them off real quick, each of them.
Well, the period falls under follicular. So follicular is like the first half of the cycle. Ovulation is that middle piece. And then luteal is that second half. Where most people experience PMS and some of those disruptive things that can happen before your cycle.
Okay.
So, yeah.
So we see such fluctuations. There's been a trend that Brooklyn and I have literally talked about probably a million times now about called like cycle tracking. And like a lot of the trend on the internet is, I feel like,
They're syncing.
Like cycle
syncing. Thank you. Cycle syncing. My apologies. A lot of the trend is like, hey, do your hardest workouts this week because you're going to have the most energy, and like don't feel bad about being like a couch potato this week because you have none of it. Is there any science to that madness of?
So there is research being done. I would not say that there's super solid science out there to support it, but I also think that it's sort of a nebulous enough thing that if someone just wants to try it and if they find it helpful, I don't think it's harmful at all.
Right.
You know? But activity-wise, like if you're on your period, you're going to be better off doing restorative exercise like yoga or walking or stretching or something like that. That's not too intensive. Once you start going into your follicular phase, you know, your energy starts increasing a little bit and you can start doing more resistance training or strength training or whatever you're into. Around ovulation is when you usually have the most energy. So that's when people mostly do like their HIIT workouts or their high intensity stuff. And then during the luteal phase, you're back to that restorative sort of, you know, yoga, walking. It's not that you can't do other things. I feel like people should do what they feel is tolerable for them, because exercise helps so much to me with anxiety and with some of those PMS symptoms. I think it helps you feel better. So even if you're just getting outside in the sunshine and walking, I mean, I think it's so good for you, you know. But those are just some of those things, some of those suggestions as far as tapering your activity for those stages that may be helpful, because I think a lot of people try to do way too much during that luteal phase, or they try to really, you know, like, I'm going to hit the gym and I'm going to get there 5 days a week and I'm going to lift for an hour. And, you know, and you're like, that's probably not the best time.
Setting yourself up for failure at that point.
Wait till your follicular phase. I think also like diet and nutrition is a big part of cycle syncing. And I know you mentioned a little bit earlier, but do you have any more to say on that? And if what you eat should change through your cycle?
You know what? Probably not. I mean, what I would say about eating during your cycle is to focus on whole foods, you know, really cutting out processed foods, cutting out a lot of refined sugar, caffeine as you can. I know that's hard, and alcohol. And I think you would see just an overall improvement in any phase that you're going through.
Why do I always crave a steak while I'm on my period?
Oh, I've seen
Maybe because you're losing blood, you know, because red meat has iron in it, would be my guess.
So that's what I want. And my body's saying, hey,
it's like,
give me more.
Give me some red meat.
So we kind of talked about this before we hit record, because that's how our conversations always go. But we were talking about the specific products that people use. Is there a product that is better to deal with our period? And does that change? Is it better to start one way when you're a kid and then, like, you know, progress to something else? Or like, how do we navigate what's best for our body when all of these things are offered to us?
I think that's a great question. I really don't think that there's a wrong answer to that question. I think it's just a matter of the person, what they're comfortable with, how comfortable they are with their body, what is comfortable for them. Some people hate wearing pads because they feel like they're wearing a diaper. Some people are like, oh, there's no way I'm putting anything in my vagina during my period. Like, you know what I mean? So that to me really depends on that specific individual's comfort level. There used to be, there still is a risk of toxic shock syndrome surrounding things like tampons and discs and cups, but the risk is so low. It's actually, I read this stat this weekend, and I didn't realize this, but there's actually more people that get struck down by lightning than get toxic shock syndrome.
Huh, really?
It's close, but it's real rare.
That's crazy.
And
And
then
I probably think about toxic shock syndrome at least once every time I have a
Well,
period.
because it's like a giant warning in the box
I
and
know.
stuff. It does make you a little nervous.
It does. But they have actually taken out a lot of the products in tampons that were causing toxic shock syndrome. Sorry.
It's hard to say.
It's like to say that 10 times fast. They've actually removed a lot of the products that were making that worse. So, and you really don't have a lower risk if you use like an organic product or anything like that.
So don't let the marketing fool you.
Yeah, don't let the marketing fool you. But for some people, like if you're on the go, I'm thinking of like a nurse on a 12-hour shift and you really don't have time to be changing a pad every couple hours or whatever. The menstrual discs are a nice option because they hold so much fluid and you can self-empty them while you sit on the toilet. You don't have to do a lot with them. And then you can wash them and reuse them. They also have disposables for people that don't want to wash and reuse. And they hold just a little bit less than the reusable ones, but still quite a lot. The cups are, I feel like the cups are really useful for a particular population of people. If you have an IUD, I probably wouldn't recommend using a cup because what they do is they suction to your cervix. So sometimes the suction is so strong that it might, I don't know if it would really expel your IUD, but it might just make it feel uncomfortable in your pelvis.
It's a little crowded up in there. Maybe not.
Yeah. And some people just don't like the feeling of that suction. It's like, no thanks. So the discs they don't like suction. They sit up high near your cervix, but they don't like suction to your cervix. So they're a lot more comfortable. You really don't feel them.
I do want to give womankind kudos real quick because I have never been in a public bathroom or somewhere where a woman was in trouble and maybe ran out or whatever, changed purses, and no one has not stepped up, or 50 people like, I forgot one or whatever, or, oh, I have an extra quarter to get one out of the I will just say, so kudos to you, women, for being just
Absolutely.
selfless people and understanding the struggle. That is something I feel like obviously men will not ever get. So let's talk about that aspect of it. I just told you how like women obviously know what this is about and are very helpful and stuff. But like, how can our other support system, mainly our male support system, how can they help us through all of this? And how should we talk to them about it without making it weird or gross or taboo?
I really think talking to them like as children, and saying, this is what mommy goes through every month, like in the most appropriate way for their age and stuff. Because then when they get to that age, it's just normal. Like if you have some sort of empathy and understanding around the process because your mom trained you well to know, okay, this is something that happens. This is something to be prepared for. This is, I think that is the most important thing that we can do now. But I think in addition to that, I think it's letting them participate in our care. Just a personal story, not to completely embarrass my husband, but my husband grew up in a family of all boys and he had no clue about anything, in that area. And so the first time I took him with me to the OB-GYN's office to get a pap smear, he was horrified.
Yeah.
And so I think there was probably a better way I could have prepared him for that.
Just throw them in the deep end right there.
But I think it's important for them, to show them what is a speculum? Like why are we doing this? We're doing this to prevent cervical cancer. Cervical cancer kills people all the time. Like it's important. It's an important screening that women have to do, so I think as far as liking it to like a normal, regular, yeah, this is how often I go. This is what they're testing for. This is what the procedure looks like. I think the more that we can include them in those conversations, I think that the less we feel shame about it and the more we can just say, hey, this is what I do, you know?
I feel like we need to make it fun. Like, oh, mom's on her period. It is like monthly movie day or whatever.
Yes.
Everyone gets a treat at the store and we all get to like just hang out and chill in our sweatpants with a heating pad or whatever. And
I think that's great.
all right, Parker, don't worry. Mommy has plans and a lot of great advice from Angela now. So.
That's funny.
So you've already touched on this a little bit. You mentioned that if you're not having a period and you're not on birth control, that's not a good thing because it means something's a little wonky with your body. But for women who do use birth control and don't have a period, is there anything wrong with not having a period every month?
I would say usually not. But the reason is because, and it depends on the method of birth control that you're using. Like if you have an IUD, for example, that's a hormonal IUD, the hormone that IUD is emitting in your uterus is actually keeping your lining so thin, there's nothing to shed off.
Okay.
So it's not bad that you're not having a period. There's just literally nothing to come out, you know? So in that case, it's totally normal to not have a period if you have an IUD.
Okay.
Some people at different phases of being on a contraceptive pill, depending on the type of pill they're on, will not have a period, you know, because their lining is too thin. And really what the common combined oral contraceptive does is it keeps your hormone levels exactly the same every day. So even when you do have a period, it's not really a true period. It's like a withdrawal bleed to keep things normal, but it's not really normal because your hormones are the same exact level every day, you know? So even though you're having a period, it's not the true period that you would be having if you were on no contraception. If that makes sense.
So if that beach trip ends up that same week that you're supposed to have your period, it is not a big deal to maybe, because they're always like a different color when you take a pill, right? Or whatever.
Sugar pills.
Yeah, they're just sugar pills.
Yeah.
They're
So
like nothing.
It's okay to skip those because nobody wants to be in a bikini with a period. I don't want to say nobody. I don't want to make assumptions here, but I would feel like it's a pretty fair one.
I mean, usually talk with your healthcare provider, of course, because they know your specific health history, but usually that's not problematic to skip the placebo pills, go straight into your active pill, and bypass that for an event such as that.
What about if you do it
Every month.
every month? Yeah.
Every month. So there's a couple different thoughts on that. For some people that have really horrible periods, one of the options that can be done with birth control is to bypass that period to eliminate those things like PMDD and some of those really, you know, really bad symptoms of premenstrual syndrome, or things like endometriosis. You know, in dealing with endometriosis, people that have it, even if they've had it taken out, it's common to bypass a period so you're not ever giving that endometrial tissue the opportunity to do what it's naturally going to do. You're suppressing it, you know, with that constant. So like what I usually do with people that just don't really want to have their period, which I totally get as well. But for people like that don't have endometriosis or something where they really shouldn't have a period, I like to see someone have a period maybe like every 3 months, you know. I don't know that there's really any research behind that. It's reassuring for me to know that if they get off birth control, that they are going to start cycling normally. But again, I don't really have research to back that up. That's just more my personal preference, you know. I know there's probably some healthcare practitioners out there that they don't care if someone ever has a period. If they want to bypass their period every month, that's probably fine with them, you know. But I'm not sure. Just for me, it's more of a comfort level thing for me, you know.
Is there anything that we talked about today or maybe didn't talk about today that you feel like is important for our audience to know about the dreaded, hopefully undreaded now, period?
My main thing is just, you know, empowerment of women. So know what your body's doing, know why it's doing it, track your body's cycles so you know what's good for you, what's abnormal for you. So I really want to emphasize that there's nothing shameful about your period. Are they unpleasant? Absolutely. But you're not doing nothing is wrong with you. You're not dirty, like it's a natural thing that God created your body to do. So it can be a pain, but I think the more we normalize it and talk about it and not feel shameful about it, the better off all the women that come after us will be,
Great advice.
Yeah.
And great insight. So thank you so much, Angela, for being here with us today. We appreciate it.
Thanks so much.
Thank you all for listening to this episode of Health Her Way. If you enjoyed the conversation, be sure to follow the podcast wherever you listen and share it with a friend.
If you have questions or topics you'd like us to cover, connect with us on Instagram or Facebook at Covenant Health, and we'll see you next time. This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.